So basically that Singapore is a place that sort of nourished the development and also the innovation in terms of ophthalmology, and also but then if for you going to Singapore at the very first place, is there any a cultural shock or difference that kind of deters you to stay in Singapore per se?
I think, yeah, I mean, it's different. I mean, training is different. I mean, obviously, culturally here compared to UK. I mean, it's not kind of like, I mean, it's a very easy place to live in Singapore, to be fair. I mean, I wouldn't say it's very difficult. You get everything that you want from a social side. The main thing was really, I didn't know that many people, to be fair. So it's more
True.
personal things than anything else. But I mean, people don't remember now, but back in 2006, Skype was just about coming online. So, they're setting up, having Skype calls with people in the UK and things as well. So, and my sister, one of my sisters lives very close in India, and so that helped a little bit, and sort of initially from a social side. And there were a few people actually who came from the UK at the same time as when I came, so that helped as well. With a little, the people that it was mainly more social than more than anything else. And I think that also at that time, and I think also now, and you saw that with the way we think about in SERI and SNEC as well. We try to think that 21st century doctors are more than just clinicians, right? And I'm not saying that you have to do, everybody's going to be a clinician researcher or clinician scientist or clinician innovator, but I think that we do more things than, say, doctors from a generation ago who were probably in their 60s and 70s, who it's fine just doing your ordinary clinical work and things like that, sure. But I think that things have changed now, and I think more people who do medicine will go into doing other things itself and to actually make some changes. And I think that's what's actually increased the speed of change and rapidity of basically our practice, has been the fact that you have people taking on these extra roles, and you can see that because if you invent something, right? I mean, whatever, a device, instrument, something like that, that can make the surgery easier. If you think about it, how many times you're going to basically use an individual, but then if this device instrument is being sold 1,000 times, the number of patients that would then benefit is tremendous from that one invention of yours that you've then developed. So your impact with respect to how it affects people is far greater than you would do as an individual person and stuff. So, I spend my whole life every day operating from 9 to 5. There's only going to be a certain number of people I'm going to be able to operate in my whole career span as a surgeon. But through invention, through research, through innovation, actually your impact can be way bigger, and how it basically affects individuals and stuff. And I think that's the opportunity that we have as clinicians, and we see the problems, right? So you see the unmet need because they're people that you see every day. So we have, it's not that, I'm, trying to talk about an aberrant condition that I've never seen before in my life. You see these people every day. So the unmet need is there. The question or not whether you can apply it and then deliver it and then getting it down to the patient. I mean, there are many challenges along the way, but this comes in learning about how to be a career researcher. And we're good at being career clinicians because, of course, that's why we all went to basically medical school. What we find very difficult is making that leap into administration, into research, into education and things like that. And that's where, it requires a little bit more either extra work to basically do that, or it requires, getting an extra skill set to be able to do this well, which is in addition to our basically clinical work.
So I think one of the things I'm so impressed about SNE is the fact that when you guys practice in clinic, but at the same time, you guys talk about a lot of research and what kind of problems that we want to solve. So the culture of tying clinician side and also being a scientist is very diverse at the same time. It's quite attractive to people going to SNEC or Singapore to work because you are doing transformative work, as you said. So from being a clinician scientist to now an SERI director, and you talk about like you can foresee what are the development in ophthalmology in, say, 5 to 10 years. So what are the predictions or what kind of thing you are foreseeing is going to happen in the field of ophthalmology?